Hello and welcome to this video lecture on analyzing policies and using the policy analysis triangle. In this session, you'll understand and be able to explain a simple framework for analyzing any kind of policy called the policy triangle. And you'll also be able to apply the policy triangle to an example policy and to your chosen policy as part of your summative assignment. Remember, yellow slides are key slides, useful for thinking about the assignment. But don't just copy them, think about them, analyze them, and then apply them in your assignment. So let's start with the policy analysis triangle, which is a framework we can use when analyzing policies. There are 4 parts to the policy triangle. We start with actors, content, context, and process. This is a very simple framework to systematically think about and critically analyze health and other policy development and implementation, as well as the policies themselves. It can also be used to plan a new policy or a change in a policy. And it's important to remember that policy development, the policy process, is a complex, iterative, and non-linear process. That means that it's not one phase following another, but the phases feed back on themselves. They're iterative. You may have to go back to the beginning. You may have to rethink what you're doing, even if you have got onto a late stage of the policy making process and have developed a lot of the content for a policy. You may decide, because of new circumstances, new stakeholders, new emerging issues, that you need to go back and restart the process or relook at different parts of the process to rethink the policy that you are developing. The framework covers the 4 key dimensions of any type of policy, but there are other aspects and other issues that it does not include or consider, and there are other models, other frameworks that can be used that complement the policy triangle framework. Just a reminder, you can use this framework in your summative essay, and we recommend that you try and use it to look at how the policy was developed, how it was adopted, how it was implemented, and why all or part of it was or was not successful. So let's start with actors. There are various types of actors, and in almost all policy processes there are a number of actors, especially in the UK, that have a role. Communities or the national population, these are the people who will benefit from the policy. National government, who develops the policy. Government departments, who work together often to develop policies. And an example of that would be drug substance misuse policy, where we would expect the Department of Health and Social Care to work jointly with the Home Office and the Ministry of Justice, because drug and substance misuse involves the police and the courts. So therefore the Home Office, which leads on policing and safety, and the Ministry of Justice, which links into courts and the justice system and prisons, need to play a part in developing that policy. Similarly, if we were developing an air pollution policy, we would work with the Department of Health and Social Care and the Department of Environment, Food and Rural Affairs, which takes a lead on developing air pollution policies and strategies. Then we have national or regional government agencies such as Public Health England or local enterprise councils who implement an action national policy. We also have local government who also implement and action national policy. We have national and local voluntary sector organisations and groups. And charities are voluntary sector organisations who often have paid staff. And looser associations are groupings in the voluntary sector in communities that are not charities and generally don't have paid staff. And lastly, but not least, are business organisations, and examples of these are food and drink manufacturers, for example the alcohol manufacturers or the tobacco industry, food distributors like supermarkets, farmers, technology companies like Apple, Facebook, Google, fashion and other retail businesses like Next, Zara, H&M. All of these are business organisations that might link into public health issues. Actors can also be categorised and analysed and put into three different groups. Individuals, politicians, civil servants, celebrities like Jamie Oliver, who made a real big push for improving school dinners for children. Groups who are loose collections of individuals. They're not organisations such as social movements like Black Lives Matter when it first started, or it could be a protest group that comes together for a specific issue. Or formal organisations with an organisational structure with a chief executive or a director or some kind of head person or project manager or organisation manager and other people, paid and unpaid, who are involved in the organisation to achieve some kind of objective. And these can be, for example, Oxfam, Save the Children, Greenpeace, it could be trade unions, and it could be professional associations like the Faculty of Public Health, it could be Public Health England, or it could be local community-based grassroots organisations, and of course it can be government and business. So how do actors affect policy? At the simplest level, they have power and influence at local, regional, national or international levels. And they can work individually or form collaborations and networks of influence, geographically, professionally, in terms of professional networks, partnerships across organisations and groups, and interdepartmental and interagency collaborations and alliances. The key to understanding actors and how they influence the policy process and how policies are developed and implemented is power and how it is used. So what is power? Power may be characterized by a mixture of individual wealth. So for example, if we look at Richard Branson, who's the boss of Virgin, or we can look at Donald Trump, they have a lot of wealth and that gives them power. We also have personality. So again, I've talked about Jamie Oliver, but you can think of pop stars and movie stars, Rihanna, Taylor Swift, Kanye West, or movie stars like Tom Cruise, George Clooney, all have personality power. They're celebrities, they're famous, and through that, even without the wealth that they have the power to influence events. A recent example that has just happened, if you have been watching the news, has been around the footballer Rashford from Manchester United, who has made a big push and who has influenced government policy around free school dinners during holidays and Christmas during this COVID pandemic. That's the power of personality. He hasn't used his money, but he's used his fame to influence government policy. There's also access to knowledge in terms of being a professional, being a professor of global health, or being public health expert in infectious diseases. That would give you power to influence government policy. And it could be authority by being, for example, politician, being a member of parliament, being prime minister, being the leader of the opposition. That authority you get from the role that you play also gives you some power to influence policy making. For example, the media have authority. The media bring knowledge to the public, and their authority as independent journalists and sources of information give them power to influence public policy. And all of this power is tied up with the organizations and structures within which individuals, groups, and organizations work. As it says below, it's the organization structures are the things within which individual actors work and live, as well as the positions of office that the individual, group, or organization holds. Power is also the interplay, the interactions, and the interconnections between agency and structure. And agency refers to the power or capacity of the actor, the stakeholder, to act independently and to make their own free choices. And structure is about the arrangements which limit the choices, opportunities, the agency of specific actors. So it's the organizational structures in society, it's the political structures, the economic structures. These can limit the choices and opportunities different stakeholders, different actors can play in the policy process. So now let's move on to content. What is policy content? Policy content is what the policy is made up of. The vision, aspirations, ambitions, aims, and objectives of the policy. And the details of how the vision, aspirations, ambitions, aim will be made real. It may also present a framework or set of principles for how the actions fit together to achieve an aim. And they sometimes also include things like outputs, outcomes, deliverables, and milestones, though often these are not in the main policy but in a separate action plan. Policy content can also fall into two strategic types of policy content: upstream or downstream policies, and these are policies that tackle higher level factors, i.e. the causes of causes, or those that tackle lower level, more direct factors. And an example is the sugar tax and traffic light food labelling versus lifestyle health education interventions or policies. So in terms of sugar tax, that affects sugar manufacturers and farmers, and the traffic light food labelling affects supermarkets. So it's acting at a very high level, affecting lots of industries and lots of organizations, and will have an impact on lots and lots of people in the community. While lifestyle health education may impact on lots of people if it's done through TV, radio, or online, but often it affects a smaller group of people. And even if it does affect a large number of people through TV or online adverts and activities, these activities and these adverts on TV only happen for a few months because they're very expensive, so they don't run forever, while the sugar tax and traffic light food labelling, once it's set up, can run for 5, 10, 15, 20 years. So just to explain this, one policy targets business and cultural and social beliefs and practices at the population level, that's upstream, and the other targets individuals and families and maybe small groups, and that's downstream. And then there can be universalist policies or selective or targeted policies, or a mixture of both. And these policies either target the whole population or target at-risk groups. For example, smoking or obesity prevention for the whole community, which would be a universal policy or intervention, versus smoking policy or intervention for young women only because they may have a higher rate of smoking or taking up smoking. That would be a selective policy. Targeting the Asian community around obesity prevention and diabetes risk, again, would be a selective policy, because we know the Asian community have a higher risk of diabetes, so we may say, let's focus on that group in particular for our obesity prevention policy or strategy. And lastly, an example of mental health and well-being, we could target the whole community and have a universal program around 5 ways of well-being, or we might have targeted counselling and other activities, including 5 ways of well-being, that focuses on those with existing physical and mental health problems, because we know people with existing physical and mental health problems are more likely to have lower well-being, and that latter one would be a selective policy. The other way of categorizing the types of policy content are, it can involve advocacy or lobbying, it can involve partnership working or requests or aspirations for partnership working, it can involve community development and improving local communities and how they work, it can involve promoting healthy behaviors, it can involve building and developing the capacity, skills and resources around staff numbers and staff availability and prioritization in organizations. It can involve improving access to health, social care and other essential goods and services. It can involve changing social and economic institutions and social and cultural norms. And lastly, it can involve redistribution of financial or other resources, for example, by taxation, taxing cigarettes or taxing alcohol, and also giving money through the social welfare, social benefit system back to those who are disadvantaged. So now let's move on to context. So what are the types of context? There's 4 broad types. Context is about the political, economic, social, cultural, local, regional, national, international factors that affect or influence policy development, the policy process, how it is implemented, how it is evaluated, the whole thing. And so there can be situational factors such as war, drought, epidemic. There can be structural factors such as the political system and the type of economy a country has. There can be cultural factors, it's the norms and customs in that society. Cultural hierarchies, for example, village elders or patriarchy, where men are favoured more than women. It could be because of faith or religion. It could be other types of customs and traditions. And it could also be things like discrimination and prejudice. For example, the position of minority communities or people with specific types of health problems like mental illness or HIV. And it could also be international factors, for example, transboundary problems where problems in one country flow to another. And we've seen that example of that with the recent COVID pandemic. And we also saw that with the nuclear incidents in Fukushima and Chernobyl, where they had a wider impact globally. And it also happens through these global chains that we have, product chains where contaminated food and drink or unsafe technology or products can go from one country to another and create public health problems. So let's move on to process as the last thing of the policy analysis triangle. And we've already covered this in a previous video lecture, and this will be a refresher. So remember, you can think of the public health policy process as to assess, analyse population health needs, or for something to come onto the agenda of politicians. We then assess possible intervention options using scientific and other sources of evidence and information, including evidence from communities. We then develop detailed policy choices and choose the most cost-effective option. We then implement the policy, and then we evaluate the policy to see if we had succeeded in achieving our vision, our aim, our ambition, our aspiration, and our objectives for the policy. And then we start the process all over again by re-looking at health needs, re-looking at the policy options, re-looking at the policy choices, and then implementing a new or revised policy. A reminder, there are many theories about how policies are made and how the policy process works. We focused on two, the rational actor model and Kingdom's multiple streams model. And for the policy analysis triangle, the one to focus on is Kingdom's policy streams model. And Kingdom identified three factors or streams to explain how policies are made. And that is the problem stream, when an issue is seen as a big problem that most people see as a big problem, most people in the community, then policy is likely to be developed in action because politicians will feel the pressure to do something about it. The policy stream is when the problem has a solution, it can be actioned, we have the money for it, we can solve the problem, and therefore, because we can action it, policymakers, including politicians, will be keen to try and implement and action the policy. And lastly, the politics stream, when a major political party or parties that have the most power support a policy, then that policy is likely to be developed and actioned. So you can look at whether the policies that we will look at later and in your assignment involve these three streams, and which stream may have taken the bigger role in designing and implementing that policy. This is a visual diagram of that, so you can see here where the problem and policy streams meet, we will have no change. Where the politics and policy stream meet, we would have no change. It's only when the problem, policy and politics stream all come together will we then get action to design and implement a policy. So what influences policy making? Well, there are many factors. We've talked about some of the factors previously in terms of context, but it's worth bearing in mind that the policy process is also affected not just in terms of the contextual factors that we've talked about before, but also in terms of these factors. Power, we've talked about that before, so power, social power, economic power, political power influences it. Values, which we haven't talked about in the contextual factors discussion previously, political values, faith values, ethical values, and wider societal values. Self-interest, for example, companies want to make profits and avoid losses, families want to cut taxes but have more services, and social movements that change, for example, Black Lives Matter, or the environmental movement, a climate change movement like Extinction Rebellion. All of these are social movements trying to push for change in society and for different types of policies. And lastly, of course, public health, through our scientific evidence and our expertise of evidence of harm to people, particularly lots of people, particularly if it's a problem that we can do something about, then that can play a big role in influencing policy making. So I hope you enjoyed this video lecture. Hopefully we'll look forward to talking a bit more and applying some of the thinking and points raised in this video lecture. Just a reminder of some of the books that are worth looking at and reading, particularly the key chapters. And to also do some background reading and background thinking and looking at the material on Blackboard